When I came to the University of Washington, I really didn't know what to do. I mean, I didn't know anything about education, quite frankly. And so I was a very shy young man. I didn't speak English fluently until after high school. Probably I became fluent in English at the University of Washington. I mean, I remember coming with a friend from Othello, and he was in the same shoes that I was, and we used to want to practice English, so we would say, we're not going to speak Spanish, just English. And we ended up laughing, every time we tried to, hold a conversation just in English. It was just, we would try, and then we just started laughing because we couldn't do it. And so I started out thinking, well, I need a field where I won't have to speak very much. So I thought, well, engineering. Engineering is a field where engineers don't have to talk. And so I went in, so I said, okay, I'll take a class, Introduction to Engineering. And then I realized, what am I going to do to help the community in engineering? I don't see what I would do in the long run. And so then decided, well, I'll be a lawyer. I'll go to law school and I'll force myself to learn the language and be a champion of the Chicano community by fighting for them legally. And so that's where I was heading. That's why I wanted to get a degree in political science. But during my junior year, I went to work on work study at a community health center in Eastern Washington in Tompkins called Farm Workers Clinic. And I didn't just want to work in the clinic. I wanted to work actually for United Farm Workers, but United Farm Workers didn't have a work study slot, and so I ended up at this clinic working half-time in the clinic, and then the clinic assigned me to work half-time at United Farm Workers, and I was getting paid, through the work study program at the University of Washington. And during my half-time that I was there at the clinic, I realized, that this community clinic was doing a lot of good in terms of providing health care to our community. And people from Othello used to go to Tompkins, which is about 80 miles away, to this community health center, because the doctors in Othello didn't accept Medicaid, or it was cash. You had to pay the whole bill every time you went, and most of our community just didn't have that money. And so I remember having to go to Eastern Washington, to Tompkins from Othello to get health care. And so I realized that that this community health center was providing a really good service. And so this clinic had a satellite clinic in Sunnyside. Tompkins, Sunnyside, which was about 15 miles, 20 miles away. And I got to know this doctor really well, and a nurse. I had a little trailer. And with United Farm Workers, our job was to organize the farm workers so that they could get better wages. And so when we were out in the camps, we would find people with health problems, and we would bring them to this clinic. And I got to know this doctor really well. Knowing that Othello didn't have a community clinic, I found out that the administrator from the Tompkins clinic, his name was Ray Esparza, was going to open up a clinic in the Tri-Cities. And so I went to him, and I didn't know him. I went to him and I said, Ray, why don't you open up a clinic in Othello? The clinic really needs, the community really needs the clinic because they're having to come 80 miles. Pasco needs the clinic, but it's only 40 miles, 50 miles to Tompkins, so it's closer. And so he said, no, we're going to open it up in Pasco. And so I said, okay. So I went to my friend, the doctor, and I said, look, can you come to Othello for a weekend? Let's plan on opening up a free clinic just for one weekend. And the nurse and you can come, and we'll find a place for you to see patients. And the idea was to get the community to see what it would feel like to have a physician in the community. And so we planned it, and we had so many people. It was unbelievable. Unbelievable. And so at the same time that we were having the clinic, we were telling the people, we can have a clinic here. We can have a clinic here, but we have to demand from the federal government and from the Tompkins clinic to open the clinic there. And as a result of that, the community became very interested. I quit my work study job there was like 2 months left, and so I came to the community to organize the community to demand that we open up a clinic. And so we were successful. We forced the Tapan's Clinic to open a clinic in Othello. And it was getting toward the end of the summer. I needed to come back for my senior year. And so we looked for an administrator that was Spanish-speaking, that was bilingual, bicultural, Spanish-speaking. And we couldn't find anybody. And so we ended up hiring a retired doctor as the administrator. And as a result of that experience, I decided that I was going to go into health administration. I thought that I would better serve the community by being a health administrator than being a lawyer. And so I came back, finished my political science degree, went an additional year, got an economics degree, and then went into health administration, a 2-year program here at the University of Washington, and with the goal of wanting to work in a community clinic. And I was very fortunate that when I graduated, I did what they call an administrative residency in Wenatchee, and after that, this position became open. And I applied, and even though I was not the top candidate, I ended up, by luck, getting the position because I didn't have any experience. I was fresh out of college. And so I got lucky, and I got the job, and I've been here since.